So anticholinergics particularly are considered potentially inappropriate for people with cognitive impairment because they have been shown that over time they actually increase the risk of developing new cognitive impairment and dementia. But in people who already have cognitive impairment, they can exacerbate the cognitive impairment and they can cause delirium, which is acute confusion. So someone who may have memory problems already, but if they take one of these medicines, they can become extremely confused in the immediate term. With kids, we have big public awareness campaigns. And I think there's even warnings on the packages about not giving cough and cold medicines to kids under 6, for example. But there's nothing similar with these strongly anticholinergic over-the-counter medicines. Some common strongly anticholinergic medicines, as you were mentioning, are available over the counter. So things like diphenhydramine or Benadryl, which people commonly don't even realize they're taking because it's so accessible over the counter. So I always tell my patients, any of the over-the-counter products that have PM or sleep in the name, like Tylenol PM, or sleep aid, often contain either diphenhydramine or something that's very similar and also strongly anticholinergic.
That medicine that you think might help somebody sleep, well, maybe not. Maybe it'll help them stay awake and agitated and confused all night.
Really, anything that acts on the central nervous system increases the risk of falls. So things like opioid pain medicines, those muscle relaxants I was talking about earlier, seizure medicines, which are often not used for people who have seizures, but sometimes they're used for people, for example, for people with dementia. They're sometimes used for agitation, antipsychotic medicines. There's a wide variety of medicines that increase the risk of fall. Actually, antidepressants also increase the risk of falls. And so, it's not to say that I never use those medicines for my patients. Of course, many of those medicines for pain or for depression, those have very important indications. But I think it's just, first of all, there are so many anticholinergic drugs and so many drugs that increase the risk of falls. And it's so easy to accumulate a huge long list of medicines that are each adding to the risk of serious side effects. Studies have shown that 5 seems to be the cutoff, where if older adults are taking 5 or more medicines, just the sheer numbers increases their risk of harm. So things like ER visits, hospitalizations. We'll often find things that are just no longer aligned with the person's goals or that just don't make sense. People with diabetes who are taking multiple medicines to push their blood sugar or their hemoglobin A1C, that marker, that blood test we follow in patients with diabetes, to push it lower and lower and lower, even though we know that in older adults, generally people do much better and are safer if we just aim for moderate control of their diabetes, not such aggressive control. When we start to add multiple medicines to push their blood sugar lower and lower, people can faint and fall. I just was talking to one of my geriatrician colleagues who's working in the hospital right now and had a patient admitted who's an older adult with cognitive impairment who was taking a medicine to lower their blood sugar for diabetes, and they ended up in cardiac arrest because their blood sugar dropped so low.
A rule of thumb is that if a person's taking 5 or more, just take a close look, ask your doctor to kind of go over it. And if you're taking 10 or more, it's oh my gosh, it may not even be a bad medicine. You're taking a stool softener, but if the stool softener is adding up to that 10th or 11th med, that might mean that, oops, we forgot to take the diabetes pill. Or on the flip side, if it's 10 or 11 meds and the person is really extremely frail and close to the end of life, well, maybe that is the important medicine, something to help with their bowels. And maybe the diabetes pill that's trying to control the diabetes really well is actually less important. So no matter what the reason, oh gosh, looking at 10 and more, it's just, do we really need this? And how do we choose what medicine we're going for?